For the next 10 seconds, think of a happy memory. I want you to really go there. Where were you? Who were you with? In my happy memory, I am sitting in a restaurant with my wonderful wife, Carlin. The sun is beaming off of her face, and we are eating eggs and avocados and hot sauce. The waiter came up to us and said, "You two look so happy." And I said, I am so happy I want to stay here the rest of the day eating eggs. The waiter walked away, but then he returned. He leaned in and said, "The manager, he said you can stay here for 2 hours, but then you have to leave." I wanted my joy to last the whole day, but positive feelings come and go. What many of us aren't as aware of is the lasting impact positive emotions have on the way our brains function and how we connect with other people. As a doctor, I became an expert in what's wrong before I was introduced to what's right. The science of happiness. The science of happiness has the potential to transform the lives of our patients and the practice of medicine. Our brains did not evolve to keep us happy. They keep us alive. This is why we have negative emotions. I come from a long, proud line of anxious Jewish people. We were so anxious that we left Eastern Europe, crossed an ocean, and came to the United States. And that's why I'm here today talking with all of you. Anger, sadness, and guilt narrow and constrict our attention on what is wrong and motivate us to do something about it. Positive emotions came after the negative ones, and they cause our minds to broaden and build. 4-year-old children asked to think of a happy memory solve puzzles better than children who think of a sad memory. College students who watch comedy bloopers test better at creative problem solving than those who watch the nightly news. Doctors who are given a video game that they always win diagnose faster than doctors who are given a video game where they always lose. Positive emotions, when we experience them, our brains become more accurate, creative, and faster. They propel us to take new perspectives, and most importantly, they encourage trust. This is why I asked you to think of your happy memory. I want you to trust me. And this is why when I meet a patient for the first time, I found that starting with what's right wasn't necessarily wrong. Hello, my name is Dr. Schlechter, and today I'm going to find out what's wonderful about you. And then we are going to find out about your challenges. This is how I've started my psychiatric interview for the past 10 years. I call it the positive approach. Eric was a 25-year-old patient referred to me for anxiety, some symptoms of depression, and difficulty at work. I asked him, "Tell me, what do you enjoy doing?" Eric replied, "I'm not enjoying anything right now. But when I was in college, I was a Division I hockey player, and I thought I was going pro." "That's amazing. What position did you play?" As Eric talked about his experiences on the ice and saw my genuine enthusiasm, he brightened. Just as we can teach doctors to have difficult conversation, there's a science to investigating good news. And when it's done properly, it increases the emotion of gratitude. Gratitude is the sticky glue that binds people together. Finding out what was wonderful about Eric didn't get rid of his anxiety, but for a moment, he felt better. It was negative emotions that got Eric to come in to see me, but it was the experience of positive emotions at the start of the interview that gets him to talk with me. To prove this, we conducted a study. Doctors were randomized to either the positive or the traditional approach to the psychiatric interview. Patients who experienced the positive approach reported that their doctors liked them, that they respected them, and that they felt appreciated. All of this from doctors learning about the science of happiness. When parents come and say, I want my children to grow up and be happy, I contradict them because parents love being contradicted. And I say, what you really want is for your children to grow up and have well-being. Positive emotions like happiness are just one component of well-being. Beyond happiness, they're the activities of engagement. This is what people call being in the zone, when time flies and you're totally absorbed in the activity itself. Eric hadn't played hockey for 3 years. He was no longer in the zone. And yes, that was a hockey joke. On top of that, he wasn't spending time with his friends. Positive relationships are the most essential piece of our well-being. We need people to share both good times and bad times. If we throw in meaning and accomplishment, we end up with a catchy acronym to define our well-being. PERMA. Positive emotions, engagement, relationships, meaning, and accomplishment. Think of each element as a bucket that you really want to fill up. Striving for well-being is the closest thing we have to a mental health vaccination. To be clear, if someone is suffering from the crippling effects of a mental health disorder, there is no well-being. But there is evidence that when people have a mental health disorder and also report some levels of well-being, they are largely spared from the worst aspects of the illness. Things like the work impairment Eric was experiencing. We can't get rid of mental health disorders, but we can lessen the burden. And we can do this by elevating well-being, both systemically and on a very personal level. And not just in psychiatry, in all of medicine. The next time you go in to see your doctor for your annual checkup, I want them to start the interview by asking you, what is the healthiest thing you have done for yourself in the past year? How might that change the session for you, the patient? And I wonder how it might change the session for the doctor. Along with therapy, I let Eric know that the most important thing for me as a doctor was that he get back on the ice. And he did. And just 3 months later, Eric was doing better at work, he was seeing his friends, and he broke his ankle playing hockey. But he was so much happier. Medicine has a proud history of promoting healthier lives. I believe we are one step away from something even greater. When medicine realizes the advantages of the science of happiness, we can help people not only live healthier, we can help them live happier. Thank you.